probably not aware. You can usually find them on Amazon or any local pharmaceutical shop where they because even they are not aware of what we actually want for these patients, so they don't follow the prescription. So remember, it should be a clearly class 2 graduated compression stockings for Vericose veins. Now, the advantages and disadvantages of the stocking or the compression therapies are if you use stockings, then you have the symptomatic relief, but you need to wear it from morning to evening. I easily or commonly say my patients that if your legs or your feet are on the ground, the stocking should be up. Means you should have the stockings on if your feet is on the ground. So from the time you are waking up till the time you go to bed, they should be on. The other advantage of stocking is that they actually hide the veins, so cosmetically it will look better. They have proven to reduce the recurrence after surgery. Now, this is after the surgery with the advantage of using stockings for 2 more months. They also prevent the deterioration or progression of the skin lesions. Disadvantage is I will not wear the stockings full day from morning to evening in this hot climate where I am sweating, going for a walk, I am going for a function, I have to attend a party. I can't wear this stocking. So there is a very, very poor compliance. Patient doesn't want to wear it full time. Then they are costly. Every 4 to 5 months you need to buy a new pair of stockings because either they become loose or they are torn. So you have to replace them regularly. Then it is very difficult to put them on for the old patients because they don't have enough strength to pull it, and again to remove it also is a challenge. Next, it is contraindicated in some of the vascular patients who doesn't have enough blood supply, especially in the patients who are diabetic and hypertensive since long time or who are active smokers. So in these patients, it is a strict contraindication because they give the compression therapy. You are compressing the leg. Already the blood supply is not enough to go into the leg, and you are compressing from outside, the blood supply will be hampered. So in the patients who have poor blood supply, in those it is contraindicated. So the leaking blood, the pigmentation, the blackening, the skin is very fragile, it doesn't have enough strength, and the healing capacity is very, very poor. So you need to moisturize the skin regularly, maintain good hygiene, and avoid any kind of injuries. Next comes walking exercise. Now, how will walking help in varicose veins? Now you have used compression stockings. They are holding the veins compressed against the tissues below. So when they are holding and you are walking, so because of the foot movement, there will be the calf muscles in the leg. The calf muscles will pump the blood back to the heart. You need to walk with stockings. Without stockings, the symptoms will aggravate. With stockings, the symptoms will improve when you are walking. Next is the weight management, because as we discussed, that obesity is a reason or one of the reasons for developing venous stasis and varicose veins. Weight management is very important. If the patient decreases their weight by 10 to 20% over some time, they start having or start noticing a significant improvement in their symptoms of varicose veins. Now, let's talk about medical management. This is given in conjunction or along with stocking therapy, chemotherapy, or surgery. Commonly used tablets are daplan and calcium doxylate. But remember, medical management or taking any kind of tablets for varicose veins doesn't give you any benefit. A strict no for medical management alone. Then let's see the interventions of the surgeries. Now in the past, these photos are coming in books, in every presentation, maybe this last 15 to 20 years. So this was known as Trendelenburg surgery. I studied about this surgery when I was in MBBS 15 years back. So this surgery is completely outdated, not done anywhere now except in remote areas where they don't have the facilities of a vascular surgeon. Those are the places where this surgery is still being done. But in today's era, this is completely a no, because there is larger advantages of endovascular procedures. Again, this was the part of the procedure at that time, preparing that you remove the entire vein during the procedure. Straight now. These are the latest treatments like endovenous laser ablation or the radio frequency ablation. I will give you a small detailed, I would not say small detail, but yes, a detailed explanation about how we actually do the endovenous laser ablation so that you actually know what will be the advantage in endovascular procedures. So both these treatments, the EVLA or the RFA, actually the basis would be to heat the vein and close it from inside. You're not removing the vein, you're not making any major cuts. To a small hole, you put the fiber inside the vein, and while removing it, you heat the vein and it closes the vein completely. So that is a simple mechanism of action, that is by heat. Ultrasound guided vein puncture is done. On the right side of the picture, you can see this is an ultrasound picture where you can see the black horizontal area, that is actually the vein. And in the center, the whitish area is the needle which is puncturing into the vein under ultrasound guidance. After the puncture, a guide wire is introduced and the laser fiber is put into the vein. So when it is introduced into the vein, it travels all along the length of the vein. Now, you can notice how the superficial, white, the upper layer, that is the skin and the subcutaneous tissue. The darker center one is the vein, and in the vein there is a horizontal long wire-like thing, that is the laser fiber. So the laser fiber is about 0.5 millimeters. It's about just a millimeter in diameter. So that is the fiber on the left side of the picture, if you see, that is the fiber that is coming out of the skin. So through a small puncture, we introduce the laser fiber into the vein, and in the groin or the right hand of the picture, you see the red light under the skin, that is under the skin of the patient. So that is about the position of the fiber underneath the skin. Now this is a diagrammatic representation on the left hand side. So that is in the center, the black area, again that is the vein, a small yellow point, that is the laser fiber. And surrounding the blue color is the tumescence or the liquid or normal saline with some chemical in it, that is given all around the vein. So the vein is there, you have a fiber going into it, and outside the vein you have all the tumescence anesthesia or the liquid which we give it under ultrasound guidance. So on the right hand side of the picture, again you can see the center white dot is the laser fiber. Outside, just outside that, the whitish structure is the vein wall. Outside that, the black is all the water that we are given, the tumescent anesthesia or the normal saline. So simple. After that, this is the final step, that we heat the vein, and while removing the fiber out, it closes on itself. So on the right hand side of the picture, if you see the laser fiber in the center is inside the vein, and while coming out, it actually ablates or closes the vein. Next. So what are the advantages? We have shown you some pictures of the open surgery, and I have shown you some of the pictures of the endovascular laser ablation. So what is the advantage? You can easily tell by yourself that there will be no scar because you're not making any cuts. There will be no general anesthesia because we are giving liquid around the vein, so that is done under local anesthesia. There will be no pain. There will be little pain obviously when we are giving you a prick. So the pain will be as much as you have a small cut on a finger or anything with the blade. So how much, what is the duration of that pain? Maybe a few hours or so, but that can be easily managed with simple tablets. So no pain in this surgery. Same day discharge. You come in the morning, surgery is done in an hour or two, and you go home on the same day by afternoon or evening. That's all. Back to work the very next day. It has got high success rate. The open surgery that we say it's about 70% success rate over a 5 years period, whereas in endovascular you have a 96% success rate over some years. Now, lesser recurrence. Complication. Now, any procedure, any activity you do, there are complications associated with it. So, you drive a car, chances of accident, that's a complication. You eat a samosa, you become obese. You eat a lot of sweets, you get diabetes. So, complications are associated with everything. Now, with this procedure, pain, ecchymosis, hematoma, skin burns, DVT, paresthesia, this has a less than 1% chance of developing a complication. 99%, more than 99%, there will be no complications. So that was about the endovascular laser and RFA. I'll give you a brief about sclerotherapy as well because this has come into vogue because patients nowadays come for actually the cosmetic reasons that they have got visible reticular veins and all. So how the sclerotherapy actually works is we give it in the form of a foam into the vein such that the vein endothelium of the wall from inside is damaged and it closes by healing process. So normally if you get an injury somewhere, it heals, closes by healing process. So we are actually injuring the vein from inside such that it closes automatically over a few weeks by healing process. So this can be done in such kind of spider or reticular veins. In these cases, the underlying varicose veins problem, if it is there, it will be treated with the laser procedure or the radiofrequency ablation. Next is the BOGA. This has come into vogue maybe 1-2 years back, but still it is not that much into practice because we didn't find any specific advantage of this procedure over the laser ablation that we do. Now, glue. There is a lot of marketing from the pharma company, you can say, about the glue. It has got different advantages over laser procedure, but the cost of this procedure is double of than the laser procedure, and still this is not covered by all the insurance companies. The major advantage of the glue would be you know about the liquid that we give around the vein before the procedure or before the vein firing the laser. So in this glue technique, we don't have to give even that anesthesia because there is no heat involved in this glue. You just go through the same axis, same puncture, same into the vein, everything will be same. You don't require any outside liquid to cool them. So glue is infiltrated there and the vein will close over time. The disadvantage, one is the cost. Second is the actual vein is not burned or fibrosed. It is actually blocked by this glue. So there can be a foreign body sensation or there is something that is there inside that you can feel by touching. So that's why glue is not regularly or commonly accepted by the patient, and we also are not told to do a glue procedure. Next, this is one of a situation where we see that a patient with DVT or has developed clots in the deep venous system in the past, that is maybe years back, a few months back, or maybe few days back. These are the procedures where, as we discussed, that the vein, if it is blocked in the deeper system, the superficial veins become bigger to compensate for the work. So, if they develop varicose veins in a patient who has got clotting in their legs before, then this becomes a contraindication for treating the varicose veins. They should not be treated because if you have a blockage in the deep system, you are also blocking the superficial system. How will the blood flow properly? So this should not be intervened. Patients should not be treated for the varicose veins if they have a history or a past known clotting in their legs. Now, how to treat this patient is simply conservative management with lifelong compression therapy and good skin care. That's all. And take a point, don't let the weight increase. It will increase your problems. With weight, the varicose vein problem drastically, very fast it increases. Before we go to the questions, let me just clarify some of the commonly asked questions by our patients. First of all, is it compulsory or urgent to get the surgery done? Urgency or emergency? Strict no. No, no, and no. So it is not an urgency, but yes, it is compulsory. Because you have a problem in varicose veins, you have got symptoms, you have started developing pigmentation, you might go to a stage of ulceration. So get some treatment. You are afraid of surgery, get stocking some. Some compression therapy is required. If you are prepared for a surgery, that's the best, go for it. Okay? Complications, as I said, less than 1%, but with good expertise and experience at our hospital, the complications rate are still very, very minimal. Recurrence chances, obviously, we are actually closing the vein with any procedure. So, over some period of years, maybe 3 years, 5 years down the line, these veins can open again, but very rarely they need an intervention. So, the recurrence is about 3 to 4% over some years. Now, if you imagine 96% patients don't have any recurrence, no problem at all. Those 3 to 4% can have. Now, why will they develop recurrence? Common reason is they increase their weight. They put on a lot of weight in the next 1 to 2 years. They don't do their walking. They have stopped using compression therapy early, and they might have some congenital disease because of which the recurrence can occur, which can be treated again if required. Now, another question is, so you have already closed the vein which is big and all. How is the blood flow? Now, you remember the first picture that there is a deep vein system, superficial system, and in the second picture, if you see, the superficial system is interconnected with so many veins. There are so many veins in the superficial system, which the main vein only might be having some problem, and then there are connections between the superficial and the deep system. So in varicose veins treatment, we are actually closing only one of the vein in the superficial system, which is actually causing the problem. We are not touching the deep system, we are not touching any other veins. So the blood flow will not be hampered, and there will be a good blood flow from the leg towards the heart. There will be no problem with the blood flow after the surgery. Thank you so much for your attention. It was a nice and great audience here. So if you have any questions, you can ask and discuss now. And let's see if you also have any queries even after the webinar. You can note down the number, the email. You can visit our Care Hospital's website and clear all your doubts. That we can take here now. So first question is from Nikita. She asked, if the vein appears blue, what can be done? Okay, so the natural color of the vein is blue. Okay, so they will appear blue is because of the deoxygenated blood. So whenever the blood is given to an organ and it's taken back, the oxygen is utilized. So when it is coming back, it is deoxygenated, so it just appears darker and the veins appear blue. Now, if the veins are bigger or on the thigh or on the leg, then you see the small, very small veins which are the blue color veins or the red color veins which are appearing. Those are called spider veins or the telangiectasias, and also the reticular veins. So if you want treatment for that, first we need to rule out any varicose veins underneath. First we treat the varicose veins, and then if required we can treat the blue color or the superficial veins which become visible. The next question is from Shri. They are asking, is there any alternative to stockings? Now, as we discussed, stockings are a part of compression therapy. Compression therapy is a completely conservative treatment, and other part is the interventions. Now, to answer your question, stockings, if you are asking me, is there any other alternatives for compression therapy apart from stockings, then yes, there are compression wraps available, there are aero wraps available, and they can be free bandage or the high flow bandages which are available. But stockings are recommended because they have its own advantage and they are cheaper compared to wraps. They are highly advantageous compared to crepe bandages. Crepe bandages will not give you enough compression, whereas the wraps and all have the advantage. They are easy to wear and easy to remove, especially old age people. They can be easily done. Now, Niranjan Rathini is asking if sorry, we'll go up. Just one question. First, we'll answer Chandrakala's question. How long should we wear the stockings? Now, there are two things. Have you got the procedure done or not? So, if you are not got the procedure done or there is no actually surgical or endovascular intervention, then the stockings are to be worn lifelong from morning to evening. The moment you get up from the bed, do your routine and wear the stockings. No giving gap. If you are going for a morning walk, you are going for a jogging, exercise, gym, wear your stockings and go. Come back, remove the stockings, do your routine, take a bath, maintain good skin hygiene, apply a moisturizer, then put on the stockings till you go to bed. When you go to bed, remove the stockings, apply a good moisturizer again, and then continue the same next day morning. Now, if after procedure you are asking, then after an intervention, the stockings need to be worn up to 2 to 3 months, depending on patient to patient. This wearing of stocking, even after the procedure, gives you an added advantage that the recurrence becomes lesser and you have better symptomatic relief. Next is Niranjan Rathi's question that I have some black spots at the ankle area but no trouble. Am I in medication? So Niranjan, what I think is the black spots can be related to varicose veins. You need to get your legs checked that if there is an actual varicose veins or not. If you have varicose veins, then these black spots can be increasing over a period of time. Sometimes black spot can be only due to skin lesions without any underlying varicose veins. Get it checked by both a vascular surgeon as well as a dermatologist to rule out what the actual reason or the exact reason for the black spots are. So we cannot give you any medications without any examination and getting you to a diagnosis. So I think that's all for the questions now. So we have one more question. What is the correct time to get the surgery done? Is immediately appearing as varicose veins in initial stages. So the correct time to get the surgery done is whenever you want. So if you have a diagnosis of a varicose veins, get it done. Why do you want to wait? For what do you want to wait? Okay. If it's troubling, get it as soon as possible. If it is not troubling you, it means that you will examine. Okay. So there is no correct time to get the surgery done, but yes, you get it done as soon as possible whenever it is diagnosed. Okay? Welcome, Chandrakala. Okay, so no more questions are present?
Sir, one question is there, sir.
Yeah. Okay, so Rahul Agarwal, yes, so she has a question that I have some spider veins but no pain anywhere. Do we need to wear any stockings from now? I won't recommend stockings in this case. Why? Because you have only spider veins which are actually more common in the females and maybe in the middle age group. So stockings are not actually recommended unless you have any kind of other symptoms like pain or swelling. And there are no pigmentation, I am guessing, so you don't have any stockings. But definitely get the varicose veins checked because there can be an underlying lesion So thank you all for the patient listening and good questions actually, nice questions from the community. So I hope you have basic knowledge about what is varicose veins and how to get it, because how you can recognize it by on your own and visit a vascular surgeon to see if you actually have a basic problem in the veins, then get it treated if required. So any further questions or any other queries, you can email me or you can WhatsApp on this number and clear all your doubts. There is a nice page on Care Hospital's website on which you can know more about varicose veins as well and you can go through. We also have some